Dr. James Magnusson, Norman Regional. Focus will be on breast cancer and breast reconstruction, but I'm going to also be doing all other aspects of plastic and reconstructive surgery. We'll do breast reductions. We'll also do skin cancers, squamous cell and basal cell skin cancers, body contouring on massive weight loss patients, difficult wounds that need muscle flaps to close their wounds. I'll be doing things like that, and skin grafts, so plan to do the whole broad spectrum of plastic and reconstructive surgery. Plastic and reconstructive surgery really focuses on soft tissue of the body. So we operate on the scalp all the way down to the plastic surgeon. We're changing the shape of tissue. An example of that would be a facelift on someone that has jowls and loose skin of the neck, is shaping the contour of their face. Those are considered not medically necessary surgeries. Reconstructive surgery is done to restore form and function of a body part that's been injured. Examples of that would be a cleft lip on an infant, breast reconstruction on a woman that has breast cancer. Those are all reconstructive procedures. They're considered medically necessary. When I was 8 years old, for some reason, I wanted to be a surgeon. I don't really know why. We didn't know any surgeons growing up, in a military family. Just really sounded like an exciting job to have. When I made it into medical school, one of our lectures was done by a plastic and reconstructive surgeon. I had never heard of a plastic surgeon growing up. This doctor came into our medical school class and talked about skin grafts and muscle flaps. It just amazed me. I had no idea there was such a thing. Of course, everyone knows that today, but we're talking about in the 1980s. What I do for fun is bicycle riding. It's a solitary sport. It's usually painful, but it's an opportunity to really solve problems. So I do a bicycle ride. I do it almost 7 days a week, and it's an opportunity for me to physically stay in good condition, but mentally work out problems. When I was 8 years old, I wanted to be a surgeon. Well, the other thing that I wanted to be was an astronaut. This is back, with Neil Armstrong and the moon landing in 1969. So the only two things I was ever interested in was either being a doctor or an astronaut.